Good morning, everyone. This is Andrew Lopez of NursingOnTheNurse.com, and we're live today with Alene Nitzky from Colorado. Alene is an oncology nurse. She is an author. She is a ultra runner. She has a Ph.D. What's your Ph.D. in, Alene?
It's in recreation.
Okay. And Alene is a coach, a health coach. However, she's taking her coaching in a very specific direction, where most of the time health coaches focus on holistic and the entire body and whole areas. She has focused on a specific disease process, and she works with oncology patients, which is not something that I've seen very often before. And she has written a book, Navigating the Sea. Do you have a copy of the book, Alene?
Yeah.
Navigating the Sea, which just came out. Congratulations.
Thank you.
Is that your first book, Alene? Or have
Yes, it is. It is.
Oh, very good. Awesome. And can you tell us a little bit about yourself?
Yeah. I went into nursing when I was 40. So I had a career before that. I worked in education, and I taught kinesiology and wellness at a small college. And then I started my own personal training business.
Oh, wow.
And I worked with people with chronic health conditions, so that I was finding out about all of their health conditions and their medications and the precautions I needed to take with their exercise. And I realized that I could do a much better job if I had a medical background of some sort. At the time, there was talk, of course, they're always talking about a nursing shortage, and right. I decided to go to nursing school. And anyway, after I graduated from nursing school, I worked in critical care for 4 years, and then I moved on to oncology. And I've been an oncology nurse now for 8 years.
Oh,
and
wow.
Yeah, so that's
a population to work with.
Yeah, it's a great population to work with. There's so much to learn. There's so many opportunities to relieve anxiety and suffering. There's just so many great things about being an oncology nurse, and I just love it.
Well, after 8 years, I hope there's something that you like about it. It make me think of Annette Signy, the yoga nurse. She was a Hollywood actress and has a long history, resume, but she was into yoga. And like you, she said, okay, I'm into yoga. It's a field that I want to pursue, but I think I could do more with yoga if I also had a medical background, give some legitimacy, and to have a larger base of knowledge. So she combined yoga and nursing into yoga nursing. Have you thought about taking the courses and your training now and franchising or teaching others how to follow in your footsteps and go in that direction?
That is something that I've considered. I've developed a concept called FIERCE, and it's around physical activity and enjoyment of movement. And there are certainly possibilities with that down the road. So, yeah. But I admire Annette's work very much. And in fact, I even quoted her in my book.
Yeah, she's so amazing. Been following her for a very long time. So projects, the book just came out, going to be promoting that, working on that for a while. What other projects do you have going on?
Right now, I'm very excited about a pilot program of Cancer Harbors. That's the program I developed for cancer survivors. We have a local nonprofit here called Hope Lives, and they are running a pilot program this year with my Cancer Harbors program. So we have breast cancer survivors who are going through my program. It lasts 6 months, and we're running 2 cohorts through it. And I just started with the first cohort last week. So I'm just really excited about getting my program out to help people in the community.
So how have you reached out to people? How are you, promoting your book? How are you getting your services out there? Can you share anything that's worked well for you?
Yeah, I've been connecting with almost all my social media connections, and it's going to be a process because I have a lot of social media connections, but I'm trying to reach out individually to people because I think it makes sense to target the people who really are going to have an interest. So I've been talking to people who have podcasts. I've booked several podcasts within the next month, and I'll continue to do that. I'm reaching out to my connections in the cancer community all over the place. I mean, all over the United States and even in the UK, and trying to get the word out that way. And so far, I mean, the book's been out for it was just released 3 weeks ago. I've had a really great response, so I'm very encouraged by that.
I bet. One thing you might want to think about is taking some short excerpts from your book. And I know you're also a blogger. You have several blogs, don't you?
I have several. Yeah, I do have several blogs. Yeah.
Just taking excerpts from your book and posting them on your blog with comments. And then you can circulate those blog posts onto Twitter, Facebook, LinkedIn. That's one of the things I've been doing with mine. And it's a constant way to draw in traffic. Using programs like Hootsuite, or there are a couple of them out there. You automate the process, make up maybe 20 or 30 posts, and then just have them go out automatically like clockwork and update them every so often. I do a lot of social media, but I know they can be really overwhelming trying to figure it out, how much time to spend on Twitter, on Facebook, on LinkedIn, on Instagram, and there's a learning curve on each one. But there are some easy ways to slice through and automate the process, do the work once, then reap the benefits for a long time to come.
Yeah, I agree. And what I've done, the few things I have done like that have been very effective, and I'll continue to do it. I'm trying to find a way to designate a certain amount of time in my schedule to do that and set it up automatically so it'll go out. So yeah.
If you're looking for more bang for your buck per se, or for your time, one thing you might want to think about are healthcare tweet chats. On Mondays at 9 p.m. Eastern Standard, there's breast cancer social media. Mm-hmm. On Tuesdays, there's healthcare leaders, and these are online Twitter chats where literally thousands of people are online chatting, watching. And one thing I can tell you is that the public wants to hear what nurses have to say. And when it comes to breast cancer or lung cancer, there are specific discussions every week on those topics. And they're free. All you have to do is show up at 9 o'clock on Mondays and chime in on conversations, and you can get your name out there very quickly to a large number of people.
Yeah, I agree. And I've been involved in some Twitter chats already, and I do participate in some of the cancer-related chats. One of the things I mentioned in my book to nurses is that these Twitter chats are a great place to learn more about what's going on with your patients, with the other healthcare professionals who are interacting with them. There are just so many opportunities to learn out there on social media. And I would love to see more nurses, more bedside or practicing nurses use these forums, because you learn so much. I mean, it gets you out of your routine of just, going to work and being on autopilot. It's just really great, and you get all kinds of ideas. So I highly encourage nurses to do that.
I get a lot of inspiration, and it surprises me the responses that I get, because I don't think of myself as a rocket scientist, but just basic nursing and background that we have. People want to hear it. And the questions that they ask, they force me to reevaluate things and say, okay, well, I hear new questions every day. It was just like we hear them on the floor from families, from our coworkers, and it's a constant process of back and forth in the interaction. It helps you grow, helps you evolve, and develop your skills even further. That's a constant learning process. Mm-hmm. So what do you think? Who would benefit from your book, and what issues are you trying to address in the book?
Okay. Well, I think that my book is for all audiences. I mean, it's for everyone who interacts with the healthcare system, which is just about everyone. But specifically for patients, survivors, caregivers, I talk about how we just don't do a very good job of preparing people for interacting with the healthcare system. I mean, those are just skills that people don't learn, like how to advocate for themselves, what questions to ask, how to be prepared in case of a serious illness diagnosis or cancer. So I talk about those issues, about just how do you become a better user of the healthcare system so that you end up getting more bang for your buck, and so that you end up having the best chance at a good outcome. Then specifically for healthcare professionals, I really want them to, first of all, examine their values around why they went into their profession in the first place, and think about what they're doing every day in their work and how it's affecting the outcomes for patients. And I could talk about that forever. So that's a much more detailed topic. And then specifically for people who make decisions around healthcare, like administrators and decision makers, policymakers, even legislators, what the consequences of their actions on the decisions they make as far as operations and legislation, how that affects the end users, how that affects the cancer patients. So it is a broad audience, and everyone can get something out of it. I have an appendix with different education programs that will apply to these different groups. And I encourage everybody to read this because I think it's a really good resource. Just to, even if anything, just to examine your values around healthcare and quality of life.
Whether it's personal experience, a friend, a family member, almost everyone's going to be exposed to cancer at some point in their lives. And it's unfortunate that when people hear a person has a cancer diagnosis, and especially if it goes into a more serious and possibly terminal issues, people just don't know what to say to the person. There's
just not knowing how to support someone with cancer. That's a huge part of this book too. I talk about that some of the awkwardness and the uncertainty, the fear around talking to someone, maybe someone you've known for years. Suddenly they are diagnosed with cancer, and there's this awkwardness and this silence. And so I address that and how to support someone with cancer, and what is appropriate to say and what you might want to think about not saying. So I even go that far in the book.
Helpful tips. And a lot of people fumble and just when they don't know what to say, they just end up withdrawing, and then that takes away from the patient, takes away from the friend who otherwise would wants to be supportive.
Mm-hmm. Yeah.
So you're talking in your book about survivorship and there being a gap that needs to be bridged.
Yeah. There's a huge gap in survivorship. We have this approach. It's really this medical approach to cancer treatment, and there's been a lot of talk about survivorship issues and the needs of people after cancer treatment for a long time. And really all that's come out of that is this thing called a survivorship care plan. And what it is, it's essentially a follow-up treatment plan. So it keeps everything kind of in the medical domain, and the patients will get a schedule for follow-up appointments, and then some basic advice on how to, just make sure that you eat right, exercise, wear sunscreen. They're just very basic bits of advice, but it doesn't actually prepare the person for doing those things and how to take care of themselves if they don't have the skills to begin with. So what this whole survivorship care plan process has done is it's just kept them as patients. It doesn't really encourage them to seek out resources in the community. I mean, it's kind of implied in there, but it really doesn't help people in their everyday lives with the actual issues that they experience, like fatigue and like lymphedema and restoring their physical function. there's a lot of it that keeps it in the rehab mode, but a lot of people get beyond that, and they need to re-assimilate with the community. And there's so many resources out in the community, but they don't find out about those in the survivorship care plans.
There's so many issues with health literacy, and with people just when start not knowing what questions to ask.
Mm-hmm.
But if we can guide them and just give them an overview of the topics, I mean, I think of education that I've had in doctor's office that I give at work, and discharge planning. Education is one area where I think we really fall short as far as the healthcare system goes. There's so many things that we need our families to know as caregivers, as our patients to know, take care of themselves. The more that patient can do for themselves, the better off they're going to be. Doctors, nurses, healthcare professionals, we do not have all the answers. I learned that a long time ago, and there's 21 years. But when it comes to educating our patients and telling them what questions to ask, what you need to be concerned with for your own health, for your own safety, the more time we can spend on that, the more we can encourage people to research on their own, the better off they're going to be, the more we can empower them and make them e-patients, so to speak.
Yeah, and that's this book does that, and it refers them to resources. It has an extensive list of questions to ask in the case of a cancer diagnosis or if you're going through treatment, and then making sure that those healthcare professionals, whether it's an oncologist or a primary care doctor or nurse practitioner, questions to ask them. So, and then making sure that they make the referrals to the resources that the person needs, because everybody's situation is different. And it's really important for people to be empowered to take care of their own health issues. And then another part of the book is aimed at preparing people ahead of time and what you can do to take more responsibility for your own health, so that if you are ever diagnosed with a serious illness or cancer, that you'll have a few basic things in place that will help you deal with the trauma around a diagnosis. Because that's really what happens right now. We have people who, they get diagnosed with cancer, it's deer in the headlights, it's, I have no idea what to do first, who can help me, and so they're really at the mercy of the medical system. And if you have just a few things in place, I'll just tell you some of the things that are in the book. I mean, if you designate an advocate for yourself before you need it, so find the person in your life who is willing to go with you to doctor's appointments and ask the right questions and to help you and look out for your best interest.
Like
that's
a power of attorney for healthcare?
Not necessarily. It doesn't even have to be your power of attorney for healthcare. It needs to be someone who has the time in their schedule who could actually go with you. It could be a neighbor. It could be a friend. It could be someone in healthcare who has the time, who could go with you. And then another thing is to talk with your loved ones, of course, and complete your advance directives. That is very important. Let people know what your wishes are in case of a serious illness. Also, find people who would be able to help you if you were at least temporarily incapacitated. Like if you had to go through some surgeries, or you were going through chemotherapy, and you need people to be able to help you do things just around the house or run your errands for you. Really, people who could do the heavy lifting, both literally and figuratively, for you if you were not able to do that, even if it was just for a short period of time. And then another thing that's really important in this book, I encourage people to take care of their existing health conditions as much as possible, because, for example, mental health. If you suffer from anxiety and depression, or depression, for example, if you can get a handle on that before a serious illness diagnosis comes along, you're going to do so much better, because you will have the resources, your personal resources, to be able to handle it. One of the worst things is when people come in with a cancer diagnosis and they're already suffering from depression, it makes it so much harder to cope. And your outcome ends up not being as good as a result. So I encourage people to take care of those things beforehand.
Yeah, do you think advanced directives and living wills really we wait so long until we need them to address that? I think that every doctor's appointment after the age of 50, a doctor says, do you have an advanced directive? Do you know what one is? Let's give you some education and resource about that. Now, rather than waiting until a person is 75 and going into for surgery and all of a sudden, oh, by the way, do you have someone who is advanced directive, can take care of things? Now, we wait so long. And I think that hospice as well should also be discussed early on in the healthcare continuum. Rather than at the end when I think the average admission for a hospice patient is maybe 7 days. We literally wait till they're at death's door to even bring up hospice and palliative care. And in the case of a cancer patient, it can make such a difference in their quality of life towards the end that from the first conversation, when the person's diagnosed, whether it's something that they think will go towards a terminal ending or not, have poor outcome, at least have the information on the table so that 6 months into a diagnosis out there, they've been through all the chemo and the radiation and all that they're not being introduced to it at the first time at the end. Introduce it earlier in the conversation.
Right.
In the process.
Yeah, and that's one of the things I talk about in the book too, around palliative care and supportive care, and then how that differs and has similarities to hospice. I mean, I look at hospice as palliative care at the end of life, but palliative care itself is to relieve symptoms and to improve quality of life. And it doesn't mean that you're at the end of life. Now that they're starting to call palliative care supportive care because there's this stigma associated with the word palliative. But if we could just look at it for what it is, it's to improve quality of life, no matter where you are in a disease process, whether you have a very early stage cancer and your outcome is likely to be very good, and or if you're somewhere in between. Helping people relieve symptoms and live their lives better, no matter where they are, is so important. And so we need to stop avoiding topics like that. We need to make it more palatable to the public. And I think that's where they're trying to go with this supportive care concept. But there's still that avoidance of talking about death and people associating cancer with death. And I mean, it's not, we have so much better treatments and outcomes now that, we really need to get the public away from immediately associating cancer with death.
Right.
It's not that way for everybody.
Terminology makes such a difference.
Yeah.
Do not resuscitate. No. People don't want to hear that, but maybe we'll switch that to, I've heard alternatives such as allow natural death.
Yeah.
How you say it makes a very big impression on people. And as soon as you bring up hospice, people think, okay, no, we're not going to give up on him now. They think that, okay, they just can't accept the fact that we're not going to do anything else. They feel like you have to do something, you have to feel like something can be done. And doctors tend to say, okay, well, yeah, there's always something more we can do, unless you're an oncology doctor, in which case they make more referrals to hospice, and they do like to introduce that concept when they see that there's a limited return on what they can do.
Right. One of the other things that comes to mind, and I've talked about this in the book too, is that there's still a lot of misunderstanding both among the general public and among healthcare professionals about people with stage 4 cancer, about metastatic cancer that has spread all over the body. And there are a lot of people who don't understand that there are many people with stage 4 cancer who can live quite a long time, and they tend to get left out of a lot of the considerations. Like, for example, survivorship care plans are not routinely given to people with stage 4 cancer. But you can't assume that just because someone has stage 4 cancer that they're on death's door. They're likely not. I mean, some people may be, but there are a lot of people out there who are continuing in ongoing treatment for stage 4 cancer, trying to live their lives. They may be around for a while, and we need to include them in our considerations for survivorship because they're alive. They need our help. And when we write them off, I think it's very unfortunate because all of our advances are creating more stage 4 patients who are living longer, and they have a lot of needs. So we need to keep them in mind too.
Can't have them be neglected. Now, just like a person on hospice, that person can go on hospice and still live for several years, for a long time. Now they're putting Alzheimer's patients on hospice care, and Alzheimer's can take 2, 3, 4, 5, 6 years. Mm-hmm. So not be in a hospice.
Yeah.
But I'm thinking, I've heard of the book, What to Expect When You're Expecting, or the pregnancy book. It's been out for a pretty long time.
I think I've heard of it, but I've never had children myself, so I'm not really up on the pregnancy and birth and all that.
That's basically a how-to book where you can pick up the book and then look through, okay, first month, second month, third month, fourth month, and it goes through the things and outlines what to expect, pitfalls along the way. I'm thinking maybe is your book something similar where a person who's been diagnosed with cancer, they can read this and then they'll have a better idea as they're going through the process, as they're going through treatment, what to expect and be better prepared for it.
The way my book approaches it is it does provide questions to ask if you're newly diagnosed. It does make some suggestions for things you can do beforehand to prepare before a cancer diagnosis happens. And then I don't talk a lot about, I talk about the healthcare system and how it affects people during the treatment process. But my book is about quality of life and survivorship beyond the initial treatment. And it does include people who are in ongoing treatment for advanced cancer, but it's not like a cookbook or a step-by-step guide through treatment. I have focused on getting beyond that.
So you've gone through chemo and you are in remission, or it's had surgery and you're stable for the moment, but now you feel like you've been run over by a Mack truck from all the chemo and you're short of breath, you haven't got stamina, you're weak, you're fatigued. I guess this is more of a way of, or more of a guide on how to rehabilitate yourself afterwards, how to get that strength and function back. Yes.
And it's also a book about being realistic, because what happens when we have this medical model again that says, okay, we've treated you for cancer, your cancer is in remission, there's no evidence of disease. All right, go out and get back into your life, have a nice life. Well, what usually happens is people need to heal from this, the surgeries, the chemo, the radiation, just the shock and trauma of being diagnosed with cancer and everything that goes along with it. It takes time, and people need to know that, yes, you are going to be fatigued. It could take a year. It could take longer. And we need to be realistic about what to expect of ourselves. Their friends might think, oh, well, okay, they're all done with cancer treatment. They don't have cancer anymore. So they should be able to just come back and, start hanging out with us socially or, pick up their normal activities. Well, they're not going to be able to do that for a while. It takes time. And the fatigue, it's not a good thing, but it's a normal part of this process in healing. And we need to, I want to talk about how people can set realistic goals for themselves so that they don't get disappointed. When 6 months out of cancer treatment, they're still having a lot of fatigue. Well, they may not be totally healed from it. it might take another 6 months or another year.
In the meantime, their family and their friends are saying, well, you're done with treatment? You look fine. And why can't you come out? Why aren't you doing more things, going to more parties, and doing things that we used to do together? I mean, you seem drawn. And they don't understand that it's not that they don't want to, but maybe they know their limits now. And they're not, as much as they may want to do things, even simple things like chores around the house, playing with their children that they used to do all the time. And now maybe they're not able to do as much, and they're not sure if they'll get back to that point. It can be difficult for them. I think personally that'd be difficult for me to accept. And children, friends, they might not understand. And you really may not want to tell them straight out, well, I don't have it anymore. And for me as a guy, that'd be very difficult for me to accept and to say to my friends and my family, I can't go jogging anymore. I can't play football anymore. I know that cancer diagnosis, that treatment, that chemo, that kicked my butt.
Yeah. And, people don't understand, because when you don't see the person as sick, maybe their hair has grown back after chemo and they've gained some weight back, but really their body is still healing. So it's, that happens a lot in the workplace too. I find a lot of people who go back to work after treatment, they're still really fatigued, and the employers and their coworkers don't understand that, even for the year after cancer treatment is done, they have all these appointments for follow-up. They have to go back for all these scans. They're dealing with a lot of anxiety about that, and they're still fatigued and still healing. And people expect them to just come back and be who they were before the cancer diagnosis. And it's not necessarily that way at all. So I think we need a lot more public understanding of what happens around cancer. And so that's another reason why I wrote this book, because the people who've been through cancer need that kind of support. They need people to understand that it's a process, and unless you've been through it, you can't really totally understand. I mean, and I wrote this book as an oncology nurse. I am not a cancer survivor myself. I'm thankful that I've never had cancer. But this is what I'm seeing from a nurse's perspective. This is what I'm seeing patients go through when they finish treatment and they're going back out into the world, and how all these different forces are interacting with them. So what can we do to support them as they come back into life?
I know even as a nurse, I've had coworkers that have been diagnosed, have gone through treatment, and then they come back and not moving quite as fast as they used to. And other nurses may say, okay, well, you're done with treatment, you should be back at 100%. And then nurses are very good when a coworker has issues picking up the slack and covering for each other. We do that quite a bit. But in case of a person who has a diagnosis and then is treated and it's supposedly done, not every nurse realizes how debilitating cancer can be, and chemo and radiation, and how much time it can take to get back up. And that can cause resentment and other issues that aren't necessarily fair, but not everyone wants to share. Not everyone wants to share their full medical history with their coworkers. Sorry, I'm just not going to do it. And not knowing that, they can get the wrong impression and cause friction at work, which is unfortunate. But I can see that happening in nursing floors and in any occupation, and even home life. I used to do all the housework. I used to do everything around the house, and now I just can't quite do all that. So others have to pitch in and help out a little more. Mm-hmm. If I can just ask a couple more questions to wrap things up, what takeaways do you want your readers to have after they read your book?
Well, I have takeaways in all of the major chapters, but one of the things for healthcare providers, I'm just going to pick nurses and physicians to start with. You don't have to be superhuman. We need to think about our values around the work that we do, and think about how it affects our patients. When we're overworked and rushed, and we have these staffing levels that are, a safe staffing level that doesn't result in sentinel events is not necessarily a staffing level that serves the patients well. And that happens with both nurses and then also with physicians. We're too busy. And so we really need to think about what we're doing and speak up and say, hey, this isn't working. This isn't working for my patients. I can't educate them in the time that it takes, that I have allotted to me when I have this load of patients. I need help. Or they need to learn to make referrals, because people have a lot of needs around cancer, and doctors and nurses don't necessarily have the skill sets, the knowledge, or the time and resources to be able to provide for those things. So I'm talking about healthcare professionals, doctors, nurses, and other providers, that we need to be able to at least be informed of what resources are out there and make the referrals, because that way our patients will have someplace to go. We can't just say, oh, well, I don't know what to do about that, and rush off to the next patient.
Support doesn't end after we discharge them.
Right. So that's the takeaway there. And then for patients and their caregivers, some of these skills around advocating for yourself in your follow-up care. And if for example, you ever have a recurrence, how you can approach it more effectively than you did the first time when you didn't know what to do. And then for decision makers, for administrators, I really want them to look at how their actions affect the patients, because the decisions they make are not necessarily in the best interest of helping the patients get well.
Sad but true. Seems like for-profit healthcare lately has become an overwhelming theme. And I'm glad that you brought up staffing and sentinel events. And on that thread, you're going to be speaking in Washington, D.C. in a couple of months, aren't you?
Yeah, I'll be at Nurses Take DC. Yay, I can't wait, because I've wanted to go there the last 2 years and haven't been able to make it, and yay, now I can go.
As a speaker, no less.
Yeah, I'm really excited. I really want nurses to think about their basic values around providing care and quality of life for patients. So my talk will be along those lines. That's all I'm going to say for now, but yeah.
No problem. It's going to be a great time. I was there. This is my third year in a row, and I'm really hoping that a lot of people can make it. And even the ones that don't, last year we videotaped all the speakers, all presentations. They're live on YouTube for anyone that wants to go in and see them. And I'll probably end up taping this year's as well. And sounds like your book is a great resource for patients, also for family members, so that they can open their eyes a little bit on, okay, it's not just me that I'm having issues. There's a reason why I'm having issues after cancer treatment. There's a reason why I can't do things I used to be doing. And even more, there are things I can do to work through it. I think that your book will be a great support resource. And with that, I thank you for your time today.
Thank you.
Looking forward to seeing you in April.
Yeah, I can't wait to meet you in person after all this time on social media.
I thank you for all your time, contributions in the Nurse Up Forum.
All right, thank you, and thank you for being for sustaining it and for doing it, because it has made a huge difference. I know for me, when I needed to get out of the hospital and move on with some of my ideas, that was just the perfect place for me to interact with other nurses and see that there is hope. There are other things that nurses can do besides be in a big organization and be entrepreneurs and interact. And I have made some amazing contacts in that group. I mean, I consider the nurses in nurseup.com, I consider them my colleagues now. And so it's been a great help. So thank you for being the main force behind that.
Yeah, thank you. Even as a nursing student, I was exposed to Laura Gasparis from Ferolio of greatnurses.com. She opened my eyes to entrepreneurship early on, and it's made a very large difference in my life. I always knew that if I got burned out, dissatisfied, fed up with one area of nursing, that I can go to another department, another specialty. But she also added another dimension where if I wanted to leave the floors completely, I could do entrepreneurship, I could do consulting, I could write continuing education modules, I'd become an inventor. And knowing that I had those options there, even if I never intended on pursuing them, just knowing that there's a place I can go has been a source of strength, of sanity, keeping me, off the edge of being burned out and quitting nursing, which I know a lot of people now, I think they're saying that 50% of new nurses are leaving the field or changing jobs within the first 3 years. And that's a really scary statistic when you think that, okay, we have 77 million baby boomers entering the healthcare system, and someone's going to need to take care of them. Someone's going to need to take care of us when we get to be that age. And we're scaring nurses off now, and the toxic working conditions are making them move away from the bedside, saying, okay, I think I'm going straight to a nurse practitioner school. I'm going to be a nurse anesthetist, anything to get away from the floors.
Yeah.
But knowing those options are there has always been a source of strength and inspiration for me. I'm glad that with the forum, we've been able to bring people together and share and explore other areas.
Yeah.
With that, I will touch base with you very shortly. Good luck with the book, and we will talk to you soon.
Okay, thank you.
Thank you.